Hi, everybody. Thanks for having me. It's been a great couple days so far. Hopefully I don't mess that up for anybody. So my discussion today, or my project, is on dental clinic images in a university image repository. So some of you probably have been involved in digitizing projects, digitizing images before. Our project is a little bit different, and we'll talk about how we solve those problems. So, you guys have probably seen something like this before, right? Slides and slides, or drawers and drawers and drawers of slides. So I was approached about a year ago by our restorative dentistry department. They have a closet full of drawers full of slides from the University of Manitoba Dental Clinic. So it's where the students practice dentistry. And all the patients sign a release form at the clinic to have images taken of their whole patient process, basically, when they first come in to getting the treatment and then to the end process. So really rich information. And it goes back to the 60s, actually. So there's lots of cases in there that we don't see anymore, like adults with cleft palates and things like that. So they wanted to use the data, use the information, and they wanted it to be digital. We just switched to a new LMS. There were lots of copyright concerns at the University of Manitoba. Last year especially, things are calming down a little bit now, thank God, but that's where this project came from. So they came to me as their liaison librarian, asking for help on how to digitize, where to put things, and how to organize this stuff, because they were not labeled really at all. Most of them have a chart number, that's it. So, again, two big problems with this type of information. The biggest is a privacy concern, so all of these images in our project are patient information. Identifiable, lots of times you can tell exactly who this person is. If you saw them on the street, you wouldn't not recognize them. And their image, or the release forms that they signed, especially in the 60s, 70s, and 80s, don't say anything about, can I put this on the web, obviously, right? But they do say that these images can be used for testing and teaching within the university. So we knew we talked to our FIA and FIPA people, we knew we were within the bounds to use it inside the university, but how to limit that to that set of people. And then the question, so with that, how do we store it, where do we store it, are we able to lock it? And then the second issue is the organization aspect. So I can't actually show you any images, which you're probably thankful for, but I can't tell what's going on in most of them. So if no one in the library world can tell what's going on, we need to involve the dentists in that tagging or identifying process. So they have to be in the loop the whole time, which is a little different, I think, than a lot of times when you're categorizing or labeling books and journals and all that kind of stuff. So those were our two things that we had to kind of figure out. So the players, there's obviously lots of people involved in this kind of project, and I had never really been right in the thick of things until this project. So there was me, the liaison. There were two dentists, or still are, two dentists who are the drivers for this. They're in one part of one department out of 5 in dentistry. There's also School of Dental Hygiene. And they're going to do, or they are doing, all of the tagging, but they've been with me the whole time on how are we going to organize all of that kind of thing. There's 3 people who are all administrative assistants with no scanning experience who've been doing all of our scanning, and they're great, really, really good, but lots of teaching involved. And there's 2 people who are actually in the room, John Roby and Carol Jackmick over there, who are doing the development stuff for us and are working on the larger image repository project at the University of Manitoba. And then I also spoke to the IT departments of the library and the IT departments of the dentistry faculty, so there were lots of people that you have to kind of talk to, and who do you talk to first, and where do you talk to them, and all of that kind of stuff. Okay, so Act 1, in which a plan is hatched. So this was a couple months, really, and people tell me this is normal, but I had no idea how long this would take. What are we going to do? Where are we going to do it? So we chose DAMS, the Digital Asset Management System at the University of Manitoba, pretty early on. Neither myself or the dentist wanted to take care of this stuff after we had digitized it. It wasn't really in any of our lives to have that space to do that job forever. So we wanted something that was university-wide, which has a far better chance of living a longer life. And DAMS was open to us being with them, so that was very helpful. And the dentistry, my dentistry people really like to be first, So this was the first faculty that the DAMS project had worked with. They'd been working with the archives and library folks before this, so that was a big win for like the dean of dentistry. And for those of you who aren't aware of what's happening with image repositories at the University of Manitoba, I have a sentence here that John helped me with. So our DAMS project is an implementation of Fedora Commons, Drupal, and Islandora through Discovery Garden. Discovery Garden maintains the system backup and storage, and the servers and storage are hosted by Amazon and Duraspace. So that might be interesting to some of you. So we choose DAMS. Good, great. And then myself and the dentist start talking about organization. How are we going to label these images? What are we going to use? We looked at mesh subject headings, medical subject headings, which turned out to be not specific enough. And then one of the dentists found a list on a website called Prosthopedia, which you probably have never been to. Prosthodontists Association, when they submit articles, they have to assign keywords. So it's a humongous list, and that's where we started from to choose what words we were going to use. We also wrote a little grant for equipment, very high-tech equipment. We bought a second screen and an external hard drive. So this is our first example of a tagging flowchart. It's in Excel. The yellow is the path of one image. Very, very, very simple, especially in this room, very simple. The dentists were really excited about having a path or a flow because at some point in the future, we would like undergrad students to be able to help us do this. So if we push them through, they can't miss a step. And so basically we went through what are all the options in each of these categories and what goes first. Quickly, obviously, became untenable to do this in an Excel spreadsheet, but it was a good way for us to visualize where we were going and how we wanted to organize our stuff. And the DAMS group was working away on figuring out how to do batch uploads and starting to talk about authentication issues and converting our data, which is basically an Excel spreadsheet report at the end of things, into a MODS format. Act 2, in which the work is done. This was a haiku deck presentation, and you put in the word work, and workout comes up, and so Richard Simmons is here with us today. So we get down to business. We have a plan. My colleague, Carol Cook, who builds lots of databases, helped us build a really little simple access database to do all of our tagging in so that we knew there would be multiple people who were not necessarily tech savvy going into this database, and I'm bad at messing up Excel spreadsheets. I can only imagine what other people are like. So we wanted to sort of lock down some of our aspects. So access seemed like a good way to do that, and we put it on a shared drive that they can look at. And that's what this sort of crappy screenshot looks like. So this is on the shared drive between libraries and dentistry, and I think eventually we'll get John in there too so that he can just harvest our images and reports right from this drive. On the left-hand side is all the information that we ask from the scanner. So anything that's physically on the slide and who they are and when they did their work. And at the bottom, sort of underneath the title, there's an internal link to the image so that the dentist can pull up this database, this record, and look at the image, see what's already been written about it, and then do all of their work on the right. So all of the tagging happens on the right. And there's a lot of words that they decided they were very important to have in here. But we kind of split them into 6 sections so that you have things that are linked and things that are not linked. And this is what we've come up with. So this is a sample image, very friendly dental image in our DAM system. So you can see the image, you can download it, and the information's at the right. So that 83078 number is the chart number, which is good because then you can track a patient through their whole process without identifying who that patient is. And then all of the subject topics are searchable as well. And there will be an authentication screen before this, and they just are going to log in with their email IDs. So simple, simple, simple again. And then Act 3 will be using the images. We are not there yet. The tagging structure and making all of those decisions has been a really big process, of course. But what we're hoping to do very soon is do a batch upload of a bunch of images and then ask the rest of the dentists in this department who aren't really involved yet to see how they like it. And then we're hoping to share our process and our structures with other dental clinics and dental schools, because we can't share our images, but we can share our structures. And then we're going to continue with other departments in dentistry at the U of M. That's it. It's my little talk. Happy for questions.
We have time probably for a question. Anyone up there in the front?
Hi there. How difficult was it, or how easy was it to get the custom metadata into DAMS or into the Islandora front end? So I understand that you had some metadata specific to the medical records. I'm just wondering how easy it was to crosswalk.
Well, from my perspective, we started with a Dublin core, the 15 pieces, made sure that the dentist understood what those pieces were and how we could fit our information into those 15, and then John built a crosswalk from the Dublin core to mods. Oh, okay. I didn't do that.
So there's nothing in the DC record that's an extra tab?
I don't think so. We kind of changed some definitions to make sure that things worked. Like creator is the dentist who took the image, who did the work. Right. Things like that. So we kind of made sure our definitions worked. Yeah.
Okay.
Janet, I was just wondering, with your right statement, the image that you used was a Creative Commons image, but what will you use when you actually have a right statement? Because they can't be reproduced outside of U of M, right?
Right, yeah. So we're still going to have that attribution Creative Commons license to sort of remind the dentists who get in here to play nicely and to not share it outside of the university. But if you're not authorized, if you're not a dentist who's in the University of Manitoba faculty, you won't get this far. You would get to the collection page and there will be a non-patient image and it'll say this is the restorative dentistry collection. There are patient slides in here. If you want access and you don't have it yet, contact probably me, I'm not sure. So, does that make sense? Yeah.
Okay. Great, thanks a lot. Super.